Living Well, brought to you by Christus Cabrini Hospital.
February is Heart Month. We are joined today by Dr. Michael Smith. He is a cardiologist. We want to talk about hypertension, commonly known as high blood pressure. New guidelines.
Sure. So hypertension is the leading reason for outpatient clinic appointments in the United States. 1 in 3 adults has hypertension, and it is a leading contributor to overall cardiovascular mortality, heart attacks, stroke, and progressive chronic kidney disease. So it's a major issue that we deal with every single day.
And you said normally we were put into 3 categories. Let's
Sure.
look at
So
those.
traditionally, the way I was trained is that a normal blood pressure was less than 120 over 80. And above that, you had pre-hypertension and separate stages for hypertension. Well, the newest guidelines, the JNC 8 or Joint National Committee 8 guidelines, sort of turn these previous numbers up on their heads a little bit. The most radical change is that for patients over the age of 60, the new blood pressure goal is less than 150 over 90. And so that is a big change, up from 140 over 90, and it's going to have a lot of consequences, I think, for a lot of Americans. Now, patients are going to ask, hey, look, I have a blood pressure of 140 over 70. I take 2 medications and I'm age 65. Do I need to stop one of them? Absolutely not. If you're on medications and you're doing well over the age of 60, have your conversation with your physician, but I would continue what you're doing. Recent randomized controlled trials have not shown a significant benefit lowering blood pressure in older Americans less than 150 over 90. In fact, most older patients are on 10, 12 medications. We call this polypharmacy. And if we can potentially lower the number of medications that they're on, they may have less side effects and may overall feel better. Now, these guidelines are a bit controversial for older Americans. The American College of Cardiology has not signed off on these guidelines, nor has the American Heart Association. Their thought is that if we lower the thresholds for blood pressure treatment, then more patients are going to go untreated and more cardiovascular mortality may occur long term. This is sort of yet to be seen, and I think this is a conversation that each patient should have with his physician.
Okay, so that's the most important message you're sharing with us today.
Absolutely.
Is to stay in close contact with your physician.
Absolutely, absolutely. And for patients younger than age 60, the overall blood pressure goal now is 140 over 90. Obviously, first thing you want to do is diet, exercise, and control your weight. After that, if you need to go on medications, there are certain specific medications based on your race, based on whether you have chronic kidney disease or diabetes that we recommend, and these are all well put out in the guidelines.
For more information, call 866-581-3627.